birth certificates. You don't hear about some of these kinds of things, but all of these issues have consequence. Again, we're going to see different births to teens. Fortunately, you see what? For every race, it's coming down. That's a success. Every report's got its own creative title. Babies having babies. Adolescents having babies. What's the problem with adolescents having babies? Talk about the issue of the duck and the grapes and whatever it all is. It's not so easy to have a baby and parent correctly. It's hard enough in the Ozzie and Harriet family to sort of have all the resources to be able to do it. So that births to teens is an issue. What do we start to see here? What do you see? What do you make from this, Brenda? Common knowledge. You see this is maltreatment reports. It occurs more often the younger the child, right? Why do you think that is? Stand up and say your answer. They're more vulnerable. What else?
They have no defenses.
They have no defenses.
Parents are kind of newer to being parents.
Absolutely. Absolutely. It's parents not understanding what the child can and can't do. Typically, the issue will occur around bedwetting or wetting your pants or whatever. Why is that a problem? Biologically, I should say. The child's bladder doesn't reach the capacity to afford the kind of control. And when the parents don't understand that, they think shouting or even some physical contact can get the child who's, quote, defiant to comply. Not exactly. The bladder isn't the proper size. The child's not going to be able to comply even if the child's interested in doing it. What's the level of poverty in this country for a family of 4? How much money does it take? Somewhere between $2,000 and $30,000. It's about $20,000. We define poverty. What does poverty define? Why do we think it costs $20,000 to care for a family of 4? What's in that $20,000 figure? Food, shelter, clothing. Is healthcare in there? Technically, shelter and clothing are not in there either, because in the old days, they would just take the cost of feeding a family of 4 and multiply it by 3. Can you imagine living on $20,000 a year? People spend more on iTunes. I mean, just think about that threshold, and that's what we're now arguing about in terms of eligibility for programs. And unfortunately, what's happened in the last year, I'm not sure you can really see it on these slides. Poverty gotten less or more? It's dramatically increased for children. It's gone up by another 2 million children are now living in poverty. Why? Can't provide for them? What happened in the last year and a half? The economy. Losing your jobs, losing your homes, not being able to pay for food for kids on the table. What's food insecurity? Fancy word. What do you see on TV for a word for food insecurity? Hunger. How many kids go to bed at night hungry in this country? the richest nation among all nations ever in history and among all of the countries on the map, on the globe. How many kids go to bed hungry at night? About 12.5 million kids are going to bed hungry. Eat anything all day. It's just, I tell you these things because there's a lot to be done if you start to pick some project. Turns out I should add to this, if I called it malnutrition, hunger, not having enough food, a form of malnutrition, inadequate, insufficient calories, how many kids have an excess amount of calories, but not an excess amount of nutrients? It's about another 12.5 million kids. So there's 25 million children who go to bed every night with a nutrition problem. And many of those kids who go to bed who are overweight or obese don't have a proper diet. Just because your weight is above the 95th percentile doesn't mean that you've got a diet that's balanced in all the necessary nutrients for brain growth and for proper development. So 25 million out of how many? 75, a third of America's children have a nutrition problem. We don't think about that when you go downstairs and you see all the food supplies and everything else. You could probably stop with this one. What's the number one issue floating around town these days? Health insurance. Health care reform. What does that mean? What's health care reform? It means the insurance companies deny people care. You can have a pre-existing condition and your care is denied. Your care can be denied simply because they decide there's that little commercial on TV about the child's riding a bike and in the box and wants to ride outside of the box. Well, the fine print, nobody reads the fine print. Nobody can read the fine print. I mean, I don't understand the fine print. But you can lose your health insurance, particularly when you need it. We have serious health insurance problems. But what's wrong with the current debate? Or at least what's the limiting factor with the current debate?
I'm not sure, but it's like they can't see what's going to happen if they choose that. They can't like see into the future. They can't see what's going to happen.
Okay. What else? Are you reading the newspapers? Does anybody in class make you read the damn newspaper? The front page of the newspaper?
Well,
Or the front page of your screens? You know, when I teach from the back of the room so I can look at the screens that what you're looking at. It's sort of interesting.
the cost to implement the program?
The cost is $1 trillion, right? Over 10 years. It's a lot of money. How much money are we spending on the war in Afghanistan? How much money are we spending on the war and on other things around the world? I mean, you know, you got to put these in relative context. You have to decide what we should invest in and what we should choose. My concern about healthcare reform is that it's become health insurance reform. Critically needed. Absolutely needed. All that nonsense about what's covered and what's not covered and when it's covered and how your care can be denied, and if you leave school and your parents' program stops and you have a condition, they'll say you can't be covered for that condition. I mean, it's absurd that the insurance companies and the companies are making, the CEOs are making $25 million a year minimum. So think about some of that when you're looking at healthcare reform and looking at the